9th, 2024 Commission on Disabilities meeting. If we could please start by saluting my trusty little flag here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If we could, Pauline, if you would do the honors of doing the roll call,
Okay.
greatly appreciate it.
Sure. So Ralph,
Present.
Pauline Perno is present. Jason Barone,
Present.
Mario Gramani.
Present.
Hi, Mario. How are you?
I'm not bad. I'm good. You?
Robert Brown.
No, I don't see him. He's I see him signing in.
Okay,
Nope.
and Ellie. Yes.
Present.
Hi, Ellie. And Asma Fuda.
No,
No.
absent. Before the first item that we have is item 1 is motion to approve the meeting minutes from the December 12th meeting. I sent these along to everyone. With the help of Pauline, we got the minutes down in writing. So I just wanted to make sure did anybody see anything incorrectly on those? If not, if someone wants to make a motion to approve the December
Motion to approve.
and someone to
second
second it.
Second.
Okay, so Jason approves it and second by Mario. Our second item is we have graciously have our guest speaker, Pat Cameron, is here. She is from the Federation of Children with Special Needs. I'm going to have her introduce herself quickly, and then we can go, and then I'll introduce the members here on our committee. I'll let her introduce herself first.
Well, thank you, and it's wonderful to be with you. As Ralph said, my name is Pat Cameron. I actually live in Arlington and work at the Federation for Children with Special Needs. I am the project director for one of the programs there called Family Ties, and TIES stands for Together in Enhancing Support. And I'll go into all of that in my PowerPoint presentation. I have been in the field of early childhood education and particularly special education for more than 40 years, and have been a teacher, as well as have worked for the State Department of Education and the Governor's Commission on Mental Retardation, and held several state positions. And in my swan song going into retirement, I am working for the nonprofit of the Federation for Children with Special Needs. So it's a pleasure to be here with you.
Thank you so much, and I'll just go around and just let you know who's here from our commission. Myself, the name's Ralph DeChico. I'm the chair of the Revere Commission on Disabilities, along with being the ADA coordinator for the City of Revere and the volunteer Revere coordinator. So that's my background, and I know you've met Pauline through emails. Pauline Perno, she's the Commission on Disabilities co-chair. And then we also have a couple of members. Mario Gramanis is one of our members for the Commission on Disabilities, and Jason Barone is another member from our commission, along with Ellie Vargas is another member, and then we have 2 other members that are not here. One is Robert Brown, and one is Asma Fuda is not here. So we have, including myself, we have a seven member Commission on Disabilities here in the City of Revere, and we, as I said, we appreciate you coming. This is very beneficial for our disability community in Revere, and welcome to start the presentation. Or if any other members want to mention anything, Pauline, if you wanted to say anything, you're more than welcome to.
No, I think Pat and I had a lovely chat over the phone, and I am so glad that she could be with us tonight. I'm very excited for this whole meeting, and to hear just about, I told her a little bit about how I found her.
Yes.
Kind of a roundabout way. I was getting mailings for someone who was receiving information from the Federation, who used to live in my home. And that's how I actually even heard about the Federation. I had no knowledge. I did work as a school nurse for on and off for 10 years. I was a public health nurse, so I did cover in the schools, but I also saw somebody's name on one of the mailers who I used to work with. And so that's what prompted me to even reach out, and I'm glad we did. And as I said, I've looked at your PowerPoint and I'm just so excited to hear what you have to say. So welcome. And I'm glad that we're doing this remotely so no one had to go out, and it is raining out here. I can hear it hitting against my window.
Oh, son of a gun. Yeah, sometimes the forecasters are right. So
Okay.
we'll see. But it is a pleasure to be with you. And this is an overview. I mean, there's just a lot to that we offer at the Federation. We are Massachusetts federally funded parent center. And so as many nonprofits, we thrive on both government contracts and state contracts. And all of which have been pretty much grants and contracts. And so we are located in Charlestown. Our main office is there at the old Schrafft's building. And so you may be familiar with it. But I will go through a little bit of our history and then, open it up for questions and so forth. So, as I said, we're the federally funded program. We work with families whose children are birth, and it really goes pre-birth, prenatal, through adulthood. And we're technically funded through age 26. And because that's what the state government considers a young adult with disabilities. And so our, main focus is how do we include our kids with disabilities? Also looking at bilingual and English, learners and those who are facing economic, cultural, and trauma-related barriers. And so it really is to provide information about access to education, access to recreation programs, access to all of the, services that families may be eligible for. So our founder is Martha Ziegler. And Martha, if you've been around as long as I have, was a force to be reckoned with. She was a parent. She has passed on, but she was a parent of a young woman at the time with disability who was denied access to public education. And as a parent, that was just intolerable for her. And so she and it happened to be all mothers, gathered around a kitchen table and really created the Federation for Children with Special Needs. We were the first parent organization in the country to be looking at, the right to education, the right to access for services, and so forth. And Massachusetts was the model used for not only state legislation in Chapter 766, which is the original special education laws, but also the architects within the IDEA, the Individuals with Disabilities Act. And so Martha really was the trailblazer. And, and so many of the families that partnered with her that created the Federation for Children with Special Needs. So as I mentioned, Chapter 766 was the original legislation here in Massachusetts. It takes the federal regulations and the federal laws. And so we had all of these different organizations sign on to really say, this is what we support for our kids and families here in the Commonwealth. That law went on to be the federal legislation of IDEA. So when we think about what we're talking about around special education is really taking a look at students in the center. And this could be a preschooler, an infant, a school-age child, a transitioning young adult, and so forth, surrounded by all of those services that make their life successful, that have to be in place. You can't have, sort of like the cogs of a clock. You can't have one of the cogs not function in order to give a young person a full and meaningful life. And so the information centers that I mentioned this is what came out of this legislation, was that there was to be at least one federally funded parent center in every single state, and that continues today. So when we think about building on Martha's legacy, she really sort of created the template that we continue to implement in today's day. When we think about equal access to programs and opportunities, and then surrounding that premise are all the necessary entities. It's schools, it's local agencies, it's youth and families themselves, and all of the different arenas. I'm going to move you in my view here that I can see everybody. And, you know, in addition, we've got the professionals and all the different state agencies, but it was essential that families be at the table. So when we think about what's necessary to make life fulfilling for everybody. Several years ago, Massachusetts created the framework for family engagement. And we have been at the table for years. Have we been valued members at the table? Sometimes. Have our voices all been heard and understood? Sometimes. So this framework really helps guide organizations like state departments, like medical practices, like schools, learn the tenets of effective family engagement. It's not just inviting people to a meeting. It's asking, when are you available? What do you need in order to attend? It's not just extending the opportunity. It's really thoughtfully and intentionally going about how do we engage with families. So when we think about, you know, families, you've got the bullet points here that every family is unique. Come from different cultures, we come from different family structures, we have grandparents raising grandchildren, we have same-sex families together raising children, we have adoptive families, we have foster families. You know, we come in different shapes and sizes, and so true family engagement looks at all the uniquenesses and all the wonderful things that families bring to our communities. And we want to be able to honor and engage families for where they're coming from. You know, the saying is meeting people where they are, and that's really true. We want to make sure that families always know that they are their first and best advocate. And I would add the word teacher in there as well. And so we really want to honor what families bring in their experience. Every employee at the Federation is either a parent of a person with a disability, they are a person with a disability, or they have a family member, their brother, their uncle. Everybody has an experience, lived experience in the field of disabilities. And so we want to make sure that true family engagement looks at the eradication of privilege, oppression, disparities, and disadvantage. It's a high bar, but we only go as high as the bar is set. And so if you have a low bar, and we know this in education, if you have low expectations of kids, they're only going to come up to what that bar is. And so we want to make sure that when we talk about family engagement, that we are setting ourselves a high bar for excellence. That we have an analogy that we use about, you know, launching things. You know, the rocket ship to launch needs a team of people behind it. You have engineers, you have, you know, drivers, you have scientists, you have all of the different aspects that really come into play when you think about family engagement. And it's system-wide. So if you think of the school, it's the receptionist, it's the janitor. It's not just the teachers and the administration. It's the bus driver. It's everybody working together to make that experience in school a successful and welcoming one. And so the same can be said for any organization. You know, you mentioned the DMV, you know, having everybody from customer service right up to, you know, who administers the driving tests and so forth, that are working together to make this a successful opportunity. So there's an expert here in Massachusetts. Her name is Karen Mapp. She teaches at Harvard, and she is I would say, the guru for family engagement. And we really abide by her principles in being able to provide supports to families that increase their capabilities, that really look at, you know, the cognition, the skill building. What are the thoughts and learning that go behind what families need to know around special education and access and laws and things like that. We also focus on the connections. How can we network with families and provide those resources? And then all of this hopefully raises their confidence in attending meetings, participating in meetings, and being thoughtful advocates for their family. And so these are anybody in any organization can grab hold of these tenets, whether it's with families, whether it's with your employees, whether it's with the public. And, you know, and I don't know if there's anybody who could disagree with the passion and the skills that providing family support and opportunities for families. So here's a little bit about how the Federation can help. And again, our services, with the exception of very few, are free. And we do have some tuition-based training, but for them, and we always offer scholarships. But give you an example. So we offer workshops and trainings. We have informational resources. We have several 800 numbers that go directly to the project that you're interested in finding out more information. And I'll share those programs in just a moment. We do individual consultation. We have people who are so well versed in the IEPs, the individualized education programs for students with disabilities. And we hold IEP clinics. And so parent can submit their IEP and just go over, even before they sign it and agree to it, and just say, this is who my child is, this is who my student is. And I'm concerned that the school is not, you know, addressing all of their areas of need. And they get some consultation and that they can then take back to the school and say, you know, I really want to discuss further evaluations. I want to discuss what appears to be the lack of whatever services. We have support for collaborations. We serve on many advisory boards across the Commonwealth and bring the voice of families and particularly students and young people with disabilities to those tables. We offer peer support to be able to, we have a parent-to-parent program where we can link families with similar lived experiences, somebody who's been on that journey and has seen the light at the end of the tunnel, if you will, and match them up with a family who's sort of struggling or coming to terms with a new diagnosis or a new adopted child or a grandparent who's, you know, has their first grandchild and they happen to be premature and they want to talk to somebody else who's been on that journey as well. And so we can link families to other families. And then, you know, we have our leadership and skill development opportunities with families as well. So we look at families with children of all ages. As I said, my experiences and my expertise are within the youngest children, early childhood. But we look with and help families from all backgrounds and family structures. We have an outreach team with language capacity in about 8 different languages. So people whose primary language is not English can talk to somebody who speaks their language. We have translation services and access to language lines. We have an annual conference, which I'll touch on at the end of the presentation, and we offer it in 8 languages. And that's not simultaneously translated. It is 100% in families' languages. And we look at the most prevalent spoken languages here in Massachusetts. And so we offer that. And then in addition to that, we are now using AI, artificial intelligence. The translations aren't 100% accurate, but it also opens up the avenue for 250 languages, which is pretty incredible. Our programs are both for students with disabilities and without disabilities. And so we really are there for the entire family. So this gets into some of the specific programs. My program, Family Ties of Massachusetts, really focuses on those infants and toddlers who may be eligible for early intervention. And so we are the warm handoff. Our phone number is and our email address and our website is in every pediatrician's office here in the Commonwealth. And so if a parent brings up concerns about Susie or Johnny's development, or the pediatrician perhaps notices some red flags in the child's development, we are the resource. We are also the resource for every WIC family, those who are getting food stamps and WIC coupons for infants through early childhood. If they are doing screenings for child development now too, and so if at that 6-month eligibility determination, there's a discussion about the child's motor development, their cognitive development, their speech, we get called and can be that referral service. We have Mass Family Voices, which looks at healthcare and health needs. Everybody on Mass Health was held harmless during the pandemic. So 100% of families have to go through redetermination. It started this past April of last year. It will go to April of this year. And everyone will have to be redetermined eligible for Mass Health. And so we have trained folks at the Federation who can assist and navigate that for families. We have School Finder, which is the program that focuses on all children with and without disabilities. If families don't know about their options, they're stymied. What happens in public school may not be for every student. So there's vocational training. There are dual enrollment programs where students can be enrolled both in high school and in community college at the same time. And so we offer School Finder. People who are looking for childcare or preschool can call the School Finder helpline. And we have staff that speak six different languages who can help navigate that school system, charter schools, you name it, with all the different options that are available to families. Special education procedures, policies, that's our Parent Training and Information Center. All of these are hot links in your copy of the slide presentation that you have. And so you can call with any question about special education, around eligibility, around evaluations and assessments. During COVID, there were students 14 to 22 who didn't receive their transition services because everybody was remote. They weren't out in their community. And so they have extended that opportunity through 4 different agencies who are funding extended services for families who missed out on those transition services. And so we have that through our Parent Information Center. A lot of our training is done through our Parent Information Center. The CPACs come under that as well. The Special Education Parent Advisory Councils come under the Special Education and Parent Information Center. They have free access to trainings. They can host them. It is all now virtual. We, prior to the pandemic, did a lot of in-person training, and now it's all online. which is so convenient and allows so many more families to engage and participate. They don't have to find childcare, to leave the house and to get out to a training. We do the peer support that I mentioned earlier about parent-to-parent program, where we will connect those families with someone with similar lived experience. And for those kids who have rare chromosomal disorders, or just, we don't have anybody here in Massachusetts we can match you with, we are an affiliate member of Parent to Parent USA and can do a national search for a match with somebody with the same lived experience. And then we have a host of programs through our Youth with Disabilities and the transition and information support programs. I mentioned the one regarding the transition services after, during COVID. We do peer mentoring. We have our youngest staff people all work in this program because they are so relatable to the youth and young adult population. Somebody's not going to listen to me, but they will listen to a 20-something, who knows how to use TikTok and, and all the different platforms, and have that, just that persona that meets young people where they are and can get them connected to programs. We offer conferences that I'll go into. But here's a little bit more about the different training and consultations that we offer for professionals. Because you have to remember, families are families, but there's all of this host of professionals who work with families and work with young people. And so we do a lot of training through our Family Engagement Center, our language and cultural access through our School Finder. Anybody can call for help. Doesn't just have to be families. I mentioned the parent leadership, including the CPACs, and then you've got the LPACs, which are English language PACs. Every district is required to have one. And then you have a whole host of families, or of young people who don't have their families. These are kids who are engaged in the child welfare system, who are in group facilities, who are removed from their families, but they still need somebody to represent them at IEP meetings. And so we have a cadre of volunteers who are trained to represent these young folks in their IEP meetings because they don't have a parent who can speak on their behalf. We do trauma-informed practices through our recruitment training assistance program that really works with those volunteers. We have Pathways. I skipped over Pathways, but Pathways is a contract we have with DCF where we help DCF really engage in thoughtful, intentional family engagement. It's always been my experience that it's sort of it is a child protective agency, don't get me wrong, but it's always, you have to prove yourself innocent and that you're almost from the get-go deemed incompetent. And so we really want to work with the child welfare system to be more strength-based. And so we work very closely with them. And it's been wonderful. We have a wonderful experience with them. And then partnering with families with healthcare concerns through our Mass Family Voices. And again, professionals can access this information and these resources as well as can families. And how we continue to help, we open up all these opportunities for at every level, whether it's education, health, human services, and so forth. And we want to make sure that all of these practices are steeped in family engagement, that are looking at language access, that are culturally responsive, and help families and professionals navigate those healthcare systems, special education, and implement trauma-informed practice. Many people are now, instead of calling it trauma-informed practice, they're calling it healing-centered practice. And so again, terminology can mean a lot. Trauma-informed can be viewed as deficit model. Healing-centered is more supportive. And so we want to make sure that we're ever growing and ever aware of the language that we use, and how we are accessible and equitable to everyone. So our annual conferences that I mentioned a little earlier, Visions of Community, is this March 9th. It's only $25. We do have scholarships available. And when we were all in person, we would get over 1,000 people at the World Trade Center, and and be able to offer a wide range of workshops on every age level. And so we've got something for those infants and toddlers. We have for preschool, we have it for school age, for transition age, youth and young adults, and then across the disability and across the language spectrum. We put out a call for presentations. We always have so many more than we can accept. And so we also try to integrate them into monthly webinars and so forth. Our Making a Difference conference happens in November, and those are specifically to support our SESPs, our special education surrogate parents, who are representing those kids who are in DCF care. We have Planning a Life, which is a 2-day conference in the fall, and it offers opportunities for families with that transition age youth and young adult, that 14 to 22, to come together, both parents and young people. We have a track for young people, those who are planning to go on to college and need that assistance and support, and those who are destined to be part of the adult service system, and be able to provide information for families as well. So there are many ways that you can stay connected, and we're just keeping up with the times and using our QR codes and so forth to get on our mailing lists, and to be we have upcoming training lists that get sent out every week to what's happening and so forth. And so there's all different kinds of ways to stay connected. So again, I want to thank you for this opportunity to be together with you, and you can call any of our 800-9. You can contact us. We have an online request form that's noted here as well, and you can just fill out what your questions are, and somebody will get back to you within 2 business days. We try very hard to keep up a positive level of customer service. So I will stop sharing and entertain any questions that you may have.
Thank you, Pat. I'll open it up to questions. I know Pauline, I can tell she's ready with some questions there, so I'm going to hand it over to Pauline.
It's not even a question. I'm absolutely blown away by the amount of information I just gained. I'm so thankful that I intercepted mail that didn't belong to me some 18 years ago. That's when I saw your first mail, and it stuck with me since then. And then, as I told you, when I saw Vivian's name on there, I'm like, oh, wait a minute, something was calling me. But I am just absolutely blown away. I myself am a registered nurse, but I had been working in the schools with special ed kids. I was in a K-2 separate, very, very sub-separate program for 2 years, almost 3 years. And I wish anything that I could have had some of this information for the parents I dealt with. And I'm hopeful that those parents were pushed or guided in the right direction, and maybe some of them have had contact with you folks. But I think back to the families that really could have used that guidance, that support, through the foundation. And I'm just absolutely blown away. And my thing that I took away from all of this was the most important thing that you can get across to a family is you need to find a way to, you can only advocate once you've been informed. And I guess from my perspective is you need to find a way to reach those families and say, we are here to help you. You may not know the question to ask,
Yeah.
But you'll get there. And I think that that's the most important thing that I've just taken away from all this. So I'm extremely appreciative.
Oh, well, you're very welcome. You're very welcome. And you're right. I mean, families don't know the questions to ask. And so when particularly, for the families that I, are fortunate to interact with, those who are looking for early intervention, we just send them a poll packet that explains everything about early intervention. And it says it's going to answer the questions you didn't even know you had. And
Right.
so, and just being very proactive in providing the resources and the information. And then we're always there to answer a question and, for callbacks and so forth. And we follow up with families, particularly those getting to early intervention, because it's a can be a very emotional time for a family just to recognize that their child's development may be a little off kilter than their other kids, or this is their first one and they just didn't have a clue. And so we follow up to make sure that they got connected.
Right.
Um, because it is up to them. Many communities have more than one EI program to choose from. Some just have one. Um, but we always try and empower the family to make the best informed decision that they can and provide them with options and resources. We
Well,
don't prescribe anything. It's just to tell them sort of everything that's out there.
give them the platter and hopefully they'll pick something.
That's right. It's like a buffet,
Yeah, there you go.
Yeah. I'll expand a little bit more on what Pauline said. Like this was so informative. And as a commission on disabilities, people reach out to you for help and answers, but legally you can't. There's only so much you can do as a commission on disabilities. And basically, what we try and tell people that we're there to give them resources. And so many people have asked for questions that if I had this to tell them, refer them to, is basically the answer we have to give them is you need to find an advocate. You need to find someone to advocate for you, your family, and your child. But to know this is almost like I hate to put it in this perspective, but this is a one-stop shop
We
for
are. Yeah, we
you
can be.
know
Yeah.
it's a one-stop shop, and this is so helpful because of a lot of questions that come to me is what can I do for my child, where do I turn to, and like you said, there are questions that they don't even know to ask,
Yeah.
and this is so helpful. And I'm sure because you say you were involved in education and the I'm sure you're aware that there was a big outcry from the federal government in September to DESE about the issues with special education in Massachusetts, and
Oh, yeah.
I don't even know if they've responded yet. They were supposed to have 90 days, and
I don't, they have responded, but I don't know if their response has been made public yet. And
okay.
I think they're waiting for OSEP, the Office of Special Education Programs, the federal government, to, respond to their response. And so
Right.
it is in the works, and they are well aware of, the work that needs to be done.
Right.
And we work very closely with them. We have a fabulous working relationship, and we don't always agree, but we have incredible respect for one another. And I think that that's where you can get the most work done, even if you're coming from opposing views.
Right. Now, one question that I have on this is that you spoke about how young adults from 14 to 22, because of COVID, there was a lapse in the transition period for them, and they've extended it. Now, what happens to the young adults that are over that age of 22 now? Have they extended it to grant them any access to that now
Yes,
to extend the
if they
age
were
bracket?
if they were part of that age group during COVID. So even if you were 22 during COVID, they have extended that now to, provide them the resources and get them connected to the services. We're working with Mass Commission for the Blind. We're working with MRC, the Mass Rehab Commission. We're working with DESE in their dual enrollment program, so that, hopefully some of these young people might be eligible to enroll in the state schools, the universities and state colleges, as well as the community colleges
Yeah.
in a dual enrollment program. And then the Department of Developmental Services, so DDS, who run our adult programs, adult services programs. And so we're working because every child, when they turn 14 and, is supposed to be invited to their IEP meetings, they're supposed to be learning to, have a voice, whether that's their voice or it's the family that voices, on behalf of them, to be thinking about what is it they want to do when they get out of school. And so, COVID just wrecked things for so many kids on so many levels. But for kids in this particular age group, when they should be doing job exploration and, getting out in the community and trying job experiences and so forth, really missed out. And so there have been those extensions.
Yeah,
Dennis Baker is one who
one
heads
thing
that.
that we one thing that we did that we did in Revere during COVID is I had applied for, there were so many different federal grants and whatnot, and I had applied for a grant um, for students with disabilities from grade K through 5. Actually extended it to K through 6. I received a certain dollar amount to students that were disabilities in our IEPs that I was able to get them an in-home tutor during COVID.
Wow.
And there's a lot of, we could talk offline about the
Yeah.
issues that I had with that, but I did have a small number of students that were able to have a tutor go to their home certain amount of hours a week for 10 weeks to 20. Then it got extended to, I believe, 15 to 20 weeks
That's great.
during COVID, because it's that they're the ones that were most vulnerable. Yeah, COVID did affect on everyone, but people don't realize students with disabilities, especially IEPs, really felt the biggest brunt of it. And that's what the issue is. That's why I was curious as to the transition, because once they're 22 years old, they're out of the school's realm of everything. So I was wondering if that got extended for the transition, because I know it was really tough, even before COVID, when a student became 22 to transition to get it done. So that's why I was wondering if that got
Yeah.
extended.
And we have a new program called Next Generation, Next Gen, who are working very closely with Mass Rehab Commission on job training skills. And these are for young people who have, I'll use the word graduated. They've,
Yeah.
left the school system, whether it was with a certificate.
Yeah, I call it aged out,
Yeah.
unfortunately.
And so, they're really working very closely with, Mass Rehab Commission, who can provide job coaching, who can provide, interview skills and in things that, students missed out on.
Yeah.
And that may not be because of COVID. It could have just been schools don't have a robust transition program. And so we have the opportunity to work both with the schools to help improve their transition services and with families directly.
Thank you. Anyone else have any other questions or comments?
Yeah, no, I wish I don't know if my mother even got anything even robust as this when I was a baby at Boston Children's, and that was at 4 months old. They had no clue what was wrong with me, and then when they found out officially I was blind in December of that year, I don't think my mother even had anything even close to this. Although my mother does read a lot. Luckily, she had some friends that were attorneys, so we had some local resources in terms of, when you live out in the country, and I think the suburbs are made out to be something they're not really. I mean, yes, they have good schools, and I'll give them that, but the supports aren't always in place. If you're not well educated on it or don't find out, people don't know, oh, well, if the school's not going to work, they can find another school system to send them to, or out-of-state schools, residential or day school. Can be also, a lot of parents don't know that, federal funding, one of the requirements is that the school system has to transport that student. But a lot of parents don't know that. So luckily, my school system was a little more smart in that respect. May not have been as smart about who they hired for teaching per se, but as my mother ran into, I was lucky that I made it as far as I did. But college is also another area where college is really, and I'm going to say this respectfully, but especially when you talk about high schools like Harvard and Dartmouth, I think they all kind of respect them. I'm going to say need a smack upside the head, because when the special ed student enters those schools, they don't think they have to provide everything. And I know one girl who actually sued Dartmouth because they were not providing the proper accommodations.
Mm.
So
Yeah, and you know, and you bring up a really good point, because at that point, if they're their own guardian, if they, you know, speak on their own behalf, there's no entitlement. They have to be willing to disclose the accommodations that they need and the fact that they have a disability. And so, you know, at 22, you're what's the word I'm looking for? Your entitlement ends. And
yep.
so, you know, you have to be able to then be your own best advocate.
Problem
And
is that most people don't know the law, and unfortunately, a lot of the laws are not clear. The other part of the problem is that also extends to the workplace. To be honest,
yep,
I've run
absolutely.
into that. Yeah, it's unfortunate. The reality is, and I think people still don't get it. You know, yes, we do treat older folks as second class citizens, and I'll agree with that. But I think the people with disabilities kind of fall into that second and third class citizenship because they're not getting, maybe might not get the same opportunities. And we, when people call out discrimination, they don't want to hear that. So
Right.
then they treat the person like they're stupid. I've seen it, witnessed it, been through it myself. You know, sometimes you're smart, but then you see it coming and there's nothing you can do to fix it. So I don't know. There's, you know, I worked for a nonprofit that let go a bunch of right around COVID after me. This was maybe a couple of years after me. A bunch of folks with disabilities, which I couldn't believe that, but they had what I had witnessed and how they treated the people. So it's kind of sad. I don't know if that stuff can be fixed. Maybe with a program like yours, and maybe push, and maybe we get more. And I think they need to have adult side of it, because some of the adults that I've seen, you know, like one of the ladies that lives where I'm living now, because I'm in an assisted living at the moment. Her daughter was had Down syndrome and had been living with her till about age 50. So that makes a big challenge to deal with. And there's not enough supports in place. And to go find anything is almost impossible. I mean, everything, even against Mass Health, against Medicare, against anything that you might need, is almost impossible to figure it out. The programs, understanding what they mean, what you can do, pace.
If you're an able-bodied person, it's almost impossible. Never mind if you're a disabled-bodied person.
But when you're entitled to it, and the problem is they also put these laws. The challenges for those with disabilities, also whether adult or young, is the income things. When you get into that, and they start looking at what is gross versus net, and the problem I have with that is what people aren't looking at. The gross part of it, that money's already gone. You're paying into Social Security, you're paying into a pension, you're paying into whatever it is, or healthcare. That needs to be taken into consideration, because net is what's you're left is what actually pays the rest of the bills. And they're not looking at that unless it's food stamps. That's a little different. And then they start to look at that. So it's unfortunate. My wife and I ran into some real situations and learned, I mean, over a period of time, there is nothing for anything. And if you become ill during that process, as I did, you find out from a group that about age 20 to 50, early 50s, are getting really sick. We just admitted to one of our facilities here, not in our location, but another one. She's 38 and developing dementia and Alzheimer's. And unfortunately, no one explains anything. And this group is being left in the cold or told to go to a nursing home. I mean, where are we looking at here? So, I mean, that's just something I might put out there so that
our work is not done. Yeah, definitely. Our work is not done. And, you know, and so that said, I always try and reflect on the changes that have been made in my lifetime. And so when you about the disabilities. I mean, when I graduated with my teaching degree, there were no special education laws. You took
Nope.
every child into your class.
Yep.
And, and I was trained in, doing diagnostic testing. I was trained, and we created this bifurcated system by having special ed and general ed, where special education was supposed to come in and fix it all, and general education only had to teach the curriculum, as opposed to teaching every child. And
Yep.
so,
That's
we've
changed.
created the system that we're stuck with, and we've got to move through and come back. So we have come a long way. I call it the disability rights movement, similar to the civil rights movement. And
Correct.
so, and because we're on sort of almost the same timeline as well, because so much in civil rights has changed in my lifetime, as has
Right.
disability. And so
Right.
we aren't done yet. And so, there's still plenty of work to be.
Maybe to work on with the hospitals like Boston Children's, for example, if they had given my mother that your numbers and your the teams, maybe she would have had some of the resources that
Mhm.
luckily she did enough of her own homework, and my aunt was a teacher, so there was some help, but sometimes those things aren't there, and so it would be something they might want to start pushing more, because it wasn't in my doctor's office, I can tell you that. If it
Yeah.
was, it wasn't brought up, and I had a good pediatrician, so I'm very surprised, but they might have, a lot of people just, there's so much coming out that they just don't know. I mean, there's
That's why we need the Commission on Disabilities to get this out there, and different organizations to push it, and the CPACs to get it out there. That's the only way it's going to help to spread it, word of mouth, until it can get into it has to be uh, something that's I don't know the right word to use. It has to be the new norm that this
Mhm.
well,
is out
agreed.
there,
Well, I agree
you know.
with that.
Yeah.
I mean, principals, but also the teachers. It has to. That whole system has to change. That it's not. Uh,
It has
and
to
I
be
think
this has to be part of the system. It has to
right,
be an added part of the system that this is this is where you need to go for that. You shouldn't have to go look for it, because they're doing Pat and her group, they're doing all this work, but they need the help for other people to make sure that they know where they are.
right.
They're doing the work, and they can only do so much to let people know where they are. You need other people to let them know where they are and that
Well,
they're there.
especially now that I mean, not as many states have separate commissions. Like for the blind, for example, that is a huge thing. Connecticut disbanded theirs. I don't know why. Still haven't figured that one out.
Hmm.
But you know, Mass has always had it. I know Oregon has one, and I know certain other ones do. Some states don't, and I can't understand that. I don't know what the purpose in that would be, because it is a unique group. I mean, unfortunately, it is the reality. Everyone thinks of Helen Keller. That's all they ever think about. Thanks to Perkins, unfortunately, that's all they talk about. But the reality is there are different levels of that out there, and people get afraid. I mean, there are people that have never encountered someone like myself and have no clue, literally don't know what to say, don't know how to react, don't know what is appropriate, what isn't appropriate. um, and so it's, and I don't take it as an insult, but it's wrong. It is just, I don't know, it's, they always look at, and I can tell when people, not just with me, but I see it when they do it to other people too, other
Mhm.
children that have whatever it may be. So I don't get it. I'm trying to figure out myself. That group, I think, will
Thank you,
help.
Jason.
No problem.
Anyone else have any other comment? I know Al must have lost her connection. She was just coming back from out of state, and she was at the airport, getting back, so she must have lost her connection while she was on the meeting. Is there anything that we can do to help promote this, as like, besides this, getting this out there with the Commission on Disabilities? Is any suggestions that's worked better to promote that you're out there? Or
Yeah, I mean, I think whatever avenue, or opportunity that you have, share the PowerPoint, have it, you had said too about having it up on your website, and things like that. Feel free to share it.
yeah,
And, we do put out a resource directory. It's available on our website. It's searchable. And so, you can check that out as well. We're hoping to get the funding to do it in a print copy again for next year. Well, I say next year, we're at the beginning of this year. But we're revising it now. It should go to the printer in the end of January and, be available, but it's 1,000+ resources
Yeah,
in there, from everything from housing to funding to, home modifications, transportation.
it's better off that it's electronic.
Yeah, it is. And you can sort it by region, you can sort it by topic, and you can sort it by language. And, and so if you have families whose primary language is Spanish, you can put in Spanish and will come up
Now
every,
is that in that is that link in that PDF, or is that's separate what you're talking about?
it's separate. I forgot to include it and
Could you send that to me?
I will.
Because
I will.
I'm probably going to try and see if we can revamp our webpage, but I can definitely include that.
Yeah.
Definitely. I
Yeah, the
really
link,
appreciate it.
we'll update it and it'll be, next year's version, but I can send you the current one.
Perfect. Perfect. Anyone else? Any other comments? Like I said, this was very informative, and I really appreciate this. This was so beneficial, and I will try and work on getting this onto the Commission on Disabilities website, which is a page on the City of Revere's website,
Great.
for there. The other thing that I don't know is a suggestion is, I don't know if you know of the organization, CODA, which is the Commission on Disabilities Online. CODA,
Yep.
was it DPC, runs that. Then maybe another organization you may want to reach out to do a presentation, because it's more than just, it's a bunch of Commission on Disabilities at once.
Oh, that's great advice. Yeah.
Yeah, because we meet once a month. The first Wednesday of every month, at 12 o'clock. If you need a contact there, just reach out to me. I can give you the contact name, to see if you want to come there. Because like I said, there's probably about at least 7 to 10 different commissions, city commission on disabilities that are there. And then they probably can share this onto their websites also.
Yeah. I mean, if you want to, just say to them what your experience was, and
Yeah.
if
Well,
they're interested.
I can send them the link too from this video,
Sure.
and they can watch it.
Sure.
Yeah. Anything I can do to help promote this. This is a great need for families to know that all these resources are out there. Like I said, I hate to put it that way, but it's almost like it's a one-stop shop with your organization.
That's our goal. That's our goal. I mean,
Yeah.
we can't solve everything. I mean, there's
No.
one area on top of my head that, we're not versed in, and that's housing.
Yeah.
And so, during COVID, there were so many people who lost housing,
Right.
because they lost their jobs. And so, it's sort of the domino effect. And so we try very hard to connect them with local housing authorities and so forth. But, we do have resources around home modifications and grant programs and stuff like
Yeah.
that, but for, livelihood and housing, that's not our
Right.
forte.
Right. Oh, well, like I said, I appreciate this. Thank you so much.
Oh, you're very welcome. It was a
Yeah,
pleasure to
and
meet
just,
you all.
send that to me, and then I'll do what I can on my end also.
Okay,
Thank
terrific.
you. Have a great
Thank
night
you.
now.
Have a good night.
Yeah.
Bye-bye.
Thank you.
Okay, I am gonna go. Hopefully, you can stay on. I'm gonna go through the rest of the meeting as quick as I can. We're gonna go to item number 3, was updates and next steps from the December 12th meeting. It was just basically, Pauline, any updates from Pauline regarding calendar for future month guest speakers? I know you were still waiting.
To hear
Yep.
back on one, which would be a really good trailer to Pat, which is the director of, he's got a different title now. That's why I've had to kind of go through different people. So I'm waiting to hear back from him, but he's from Franciscan Children's Hospital.
Yep.
All about adaptive activities, not necessarily sports or education, but just adapting. And it would be probably a really good trail onto Pat. I don't know if I can outdo myself on finding Pat though.
Yeah, that was phenomenal. That was
I-
absolutely, that was great.
my only wish is I wish Robert Brown had been with us, because I think that to link him to her, to their CPAC development, would have been a great rollover and boost to maybe get our CPAC back up
Well,
and running.
we 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 heard some things from our meeting last week that I still have to find out some information about. So
Good.
all right.
So, but other than that, I do have him on. Like I said, waiting to get back confirmation from him, and then I'm just going to start reaching out to some other folks and see what we can find.
Okay. All right. So item number 4 was quoted at the Commission on Disabilities Alliance. As you saw from the notes, it's pretty lengthy. Monthly Zoom meeting, which was held last Wednesday, January 3rd. Um, I think I might have left not ready in time for posting. We'll provide details during the meeting, but I actually did get it put in there, but I forgot to take that out, I believe. The Senate was going to be discussing and voting on the wheelchair warranty bill that was happening last Thursday. I was also made aware that the Senate did pass it, and now it's moving on to the House for their vote. For that,
Oh.
so that's for the wheelchair warranty repair bill. DPC, Disability Policy Consortium, is what DPC stands for, mentioned that they're going to be having a meeting at this time. They mentioned next Wednesday, which is tomorrow, January 10th, to discuss and promote advocacy plans for accessibility and affordable housing. So if anybody was interested on that, they could just reach out to the Disability Policy Consortium for more details on that. There was also discussions we had regarding what apex curbing cuts are and where they are used. Not sure if everybody is aware what apex cuts, curb cuttings are. Jason, are you aware what they are?
Yeah, it has
Okay.
to do with
Yeah.
the wheelchair side. Yeah.
Yeah, well, what
Specific.
it basically is, what an apex curb cut is basically if an intersection is a corner intersection and it
Yep.
has crosswalks to the left and to the right, instead of putting two curb cuts, they'll put what's called an apex. It's a rounded one in
Yeah.
the middle.
Right.
So it's kind of dangerous because for a person that's visually impaired does not realize that, because they'll walk in the curbing and they'll think that the crosswalk is straight and they can go on to oncoming traffic.
Right.
I think the
Yep.
crosswalk is there.
That's
So there was some
ridiculous.
discussions, there was just some discussions on that, how, that's not always best practice. In Revere, I tried finding, I don't think we have any of those in Revere that are city streets. I cannot say if any state roads that run through Revere have it, but I'm not aware of it. I believe all our cuts are, there are double cuts if the crosswalks are going in two different directions, but I may be mistaken. To me, it's like something that it's allowable, but it really shouldn't be allowable. So there are discussions for that to change with PROAG, which is the pedestrian right of way guidelines. So hopefully that may be getting changed through some type of regulations. Also, cities and towns also reiterated that we've also mentioned that cities and towns do not have any official power of authority by law. CODs are there to provide resources and any applicable information that they can. So that's one thing that we try stressing, that people say, well, why are you a commission on disabilities? You don't have any power, but we're here to try and give out resources to let people know, as we just had someone here, Pat just gave us some resources that we wish we knew about that were out there so that we can have for people. So that's what we are. We're a source of getting information for people with disabilities in our communities. So that's what we're here for. Also, a commission member from Newburyport mentioned 2 items that could be useful for people with disabilities. They are one that's, I have the website in it in the agenda. It's www.accessnavigators newburyport.com, which is a web-based company in their community, which Newburyport is a part of it. And the second is an app that was also mentioned on Chronicle. It's www.ahoimate, AHOIMATE.com. Nori, no Report is currently a part of Access Navigators. Both of these sites are set up or can be set up to show the accessibility and accommodations of places such as restaurants and businesses have in their community. So I am waiting to get some more information from Newbury Report and how they became involved with it. If you go to those two websites, if you click on the link in the agenda that I sent you, it'll take you right to those links and you could take a look at them. If anybody wants to take a look at those. So I'm going to try and do a little bit more investigation on those, but they seem like something to take a look at. I'm trying to see how Newburyport became involved with Access Navigators, how they became one of their communities that was able to use it. Also, item number 5, the CPAC January, February events. No information was available at the time of the posting from Robert Brown. And unfortunately, he's not here tonight to update on any of that, so I cannot give any information for CPAC. Item number 6, Vice Chair Pauline Perno want us to have a discussion on silent disabilities and the impact everyday ignorance has. I didn't know if you want to discuss on that or if you wanted to table that till next meeting.
Table that, but just to let you know, after you just spoke about the access navigators in the Ahoy app, there, and it was going to be part of what I wanted to discuss for those of us who have some silent disabilities. There is an app also for finding restaurants that will accommodate special food needs, a special dietary. So there is one for that as well. But yes, let's absolutely table that, and we can have a discussion when we have a better chunk of time.
Okay,
excellent.
Perfect. Item number 7 is the Department of Elementary and Secondary Education is seeking comments on special education procedures. This one's very important, so anyone that wants it, there's a lot of information on the agenda with the blue highlighted links that you can click to get right to them. But I'll briefly just read this. A lot of it might not make sense because they're links to hit, but the department has drafted updated procedures as part of its continuous efforts to improve its system of general supervision under the Federal Individuals with Disabilities Education Act. Abbreviation is IDEA, and is seeking public comment on these drafts. The draft procedures include school monitoring procedures and problem resolution system office procedures. Then it's blue that links to this draft procedures. You hit that and it'll give you a link to the procedures posted on DESE's special education webpage. The public comment will close on Friday, January 26th. Written comments may be submitted to. Then it has the survey and it has the exact link there in blue on my agenda page so that you can click to it or type it in. And there's also an email address where you can email it, or in the agenda, there's also a postage mail address and a fax number. In addition, the Special Education Advisory Panel will meet virtually to provide input on these draft procedures at 9 a.m. on Wednesday, January 24th. The meeting will include a public comment portion from 9 a.m. to 10 a.m. More information about this at the SEEP meeting, which is Special Education Advisory Panel, including directions providing public comment during the meeting, can be found at this link. And as I mentioned in my agenda, it's hyperlinked in blue. So if you just go to the agenda on that will be posted in the Commission of Disabilities page, probably by tomorrow, or on the City of Revere's calendar page for meetings for tonight's meeting. You click on that, it will take you right to that. So hopefully I tried making it as quick and as clear as possible. I didn't know if any members had any questions on that. Was that okay how I did this item?
Yeah. Yep.
Because I wanted to put the links right in there so they can click on the agenda to do it that way. Because as you can see, they don't make easy web addresses or links. So
No.
so I just had to include them and make them hyperlinks to go right to them. Item 8, commission members late items of information. I just have one that I'd like to announce. I received a phone call and an email late Friday that I haven't had a chance to call back because I've been busy with some other things that I've been doing. But the phone call and email was from Terry Koopman, who's the outreach specialist from DCI. And she wanted to call and and thank us. She saw our article, and I believe she may have gone to the YouTube channel, Revere TV's YouTube channel, and saw our presentation at the December meeting with the us highlighting the DCI's adaptive winter programs. And she was very grateful for that and thanked us for all our work and helping promote that. And asking if we needed, if there's anything else that they can do for us to reach out. So I wanted to thank all of you for that and to let you know that I guess our work is being seen. And as we did, we're trying to just be as informal as we can for all our residents as we can, and hopefully we are getting some good information out there for our residents. So I didn't know if anybody had anything else for any late items or information on that.
Well, I think the question would be on that. I'm a little concerned that now we've got to create a wheelchair law for warranty, but I am wondering if this is for people that went and purchased these wheelchairs on their own, which if you go through the doctor and go through proper channels and insurance pays for it, they have certain things they have to meet when you get your chair, like mine does. And
Well,
they
that's
have to
yeah. I
maintain.
wish Elle knows a lot more about it, but obviously she
Yeah,
must have lost her connection getting home. She's been
yeah.
involved in it. Uh,
Okay.
but what we can do is we can ask her to talk on it next month on it too,
Yeah.
and it still has to
Okay.
go through the House.
Right.
So we can put that as an update next month's meeting to see
Yeah.
if Elle can update us a little bit more on that.
Well, because the insurance, and the reason I put that out there is that if it might be better for them to look at what Medicare requires and what the insurances require for the manufacturers that make certain chairs, because what people are doing are buying the things from the commercial market. And I'm just thinking, while we have a chance to save this, maybe, you know what I'm trying to say? Because we want it to be as robust as possible,
Yeah,
because then it might pick up for other states. I was just thinking ahead when you brought that up. So I'm just thinking that might, before they fully vote on it and goes and get signed, we might have time to fix it. I'm just
yeah.
thinking to protect everybody, because if they all
Yeah,
had to
she'll know
maintain the
more
same,
about the law. She'll know more
yeah,
what's in it. I think she's been helping work on it.
yeah, gotcha.
I don't want to misspeak on it because
No,
I don't know all the ins and outs on it. So that could all be already included in it. So she'll be able to probably give us some more insight into that.
gotcha.
Okay, number 9 is residents' concerns and issues. Um, I think I basically, a lot of residents' concerns and issues, I think from my comment from CODA, when people wonder what the Commission on Disabilities is here for, that's what a lot of concerns are, what we do. And I basically, we're here as a resource provider and try and answer as many questions as we can for them legally. We're here as a resource for them. But other than that, I really haven't gotten any basically residents' concerns or issues. The only other question that I had for Pauline is if anybody has gotten back to you from Somerville yet
No,
about their snow program. That just came to
nope.
bed.
I
Okay.
haven't heard anything back. And as a matter of fact, I had a conversation with someone because there was another community that was also doing it. And the question also became, because we have the JROTC, how would that then be delineated between, like, if as people drop off of that grid from JROTC, would other folks just go onto it and then that come out of, there was a lot of logistical stuff from this other, I don't even remember the community person that I was talking to, but it was not Somerville. I never heard back from them. So I'm not even sure they're still doing it.
Okay. All right. Do you want to just put that as an update
Okay,
for next month, just
follow
in
up
case?
that.
Yeah.
Yep.
Perfect. Okay. Now, so that will be as a next step. So we
Yep.
have a couple of things next step. We have Ella's thing for next step and a couple of things from you.
Yep.
Item number 11 is the reminder. Did you want to read it or did you want me to read it? How's your internet?
Yeah, I want to read it so I don't start coughing and hacking halfway through. That'd be
Okay.
great.
Okay, the Commission Disabilities Office number is 781-286-8267. Residents can also call Revere 311 directly and speak to their staff Monday through Friday. They will be able to answer most questions, but they are unable to, or if you would like to speak to our department directly or to schedule an appointment, please ask to be transferred to the Disability Office. If we are unavailable, please leave a detailed message and someone will get back to you as soon as possible. As always, please let us know if you like something discussed or brought up and added to our monthly meeting agenda. You can also let us know if you would like to speak on any issues or concern. The Commission is here to help and assist all of the disabled residents and families of Revere. Our next meeting is going to be Tuesday, February 13th at 6 p.m. Could I have a motion to adjourn?
Motion to adjourn.
And a
Second that.
second?
Second that.
Okay, well, thank you so much. This was a great informative meeting. Sorry it was a little bit longer for everyone, but hopefully you all got a lot out of it like I did.
Yes, it was excellent.
Thank you so much. And
All right, stay well.
stay well.
Hey, what?
Have
Bye,
a good
everybody. Bye.
Bye.